With sleep apnea and dentistry, they connect in a way because we as dentists are always dealing with the way the teeth fit together, the jaw relationship, how the upper and lower teeth fit together, and especially in my practice because I do a lot with joint and jaw pain patients, so we're always repositioning the jaw to help the popping and the clicking and different things with their jaw. I've been practicing dentistry for over almost 30 years now, and have been involved in a lot of TMJ and cosmetic reconstructions and things of people's mouths. I always noticed that in a certain group of people, there were a lot of people that still had trouble breathing it. They would comment on it in a day, and then they grind their teeth and different things that have been correlated to sleep breathing problems. It affects everything from your high blood pressure, gastric reflux, diabetes. There's all kind of health issues associated with any kind of sleep disorders or sleep breathing disorders at night. I mean, the CPAP is the great option to have for sleep apnea. About 40 to 50% of the patients that are given a CPAP cannot wear it. And here at our office, we are very thorough. We have everything from a three-dimensional cone beam picture to look at the airways to verify before and after that the airway is open. We follow up with home sleep studies to make sure that with the appliance is correct position to get the adequate breathing. And it's amazing how much you can change somebody's life. I actually went through a great deal of study and got my diplomat in Academy of Sleep Disorders. So I spent a lot of time and effort studying all the different ways to make you breathe better, and obviously use myself as part of that package of looking at things and different appliances and which ones work the best. And so everything every patient has had here, I've actually worn and had the same results. So I know when I'm talking to a patient, I can understand and relate to where they're coming from with all this.